Hello, my name is Dr. Joseph, and after 17 years of practicing medicine, I have walked alongside thousands of patients through their most vulnerable and most triumphant moments. I have witnessed recoveries that defied every expectation, and I have sat in silence beside families facing the unimaginable. All of those years on the front lines of healthcare taught me something that rarely gets said out loud, and I believe you deserve to hear it today. Sometimes, the smartest medical decision you can make is knowing when not to act. What I am about to share goes against everything most people believe about preventive medicine, and I want you to stay with me, because by the time I finish, you will see your health in a completely different light. I am going to walk you through 5 routine medical tests that I personally, after the age of 70, would never agree to undergo. Not out of rebellion, not out of recklessness, but because nearly 3 decades of watching real consequences unfold have shown me that medicine, in its obsession with detecting everything, can sometimes do far more harm than good. These tests are sold to us as the pinnacle of prevention, but they can pull us into a spiral of anxiety, invasive procedures, and complications that rob us of the very things that matter most at this stage of life: our independence, our peace, and our joy. If you are over 70, or if someone you love is at this stage, what I am about to share could genuinely change the decisions you make. And now, before I go further, if you find value in content like this, content built on real experience and honest science rather than fear, please subscribe to this channel and ring the notification bell so you never miss what comes next. It takes 1 second, and it could be one of the best health decisions you make today. Now let us begin with the first test on my list, the one that sounds the most impressive, the full body scan. Clinics advertise it with polished brochures and gleaming machines, promising a head-to-toe review using the latest resonance imaging and tomography technology. It sounds extraordinary, a complete picture of everything happening inside you, a way to catch any threat before it even appears. But the reality is very different, and far too often, it is dangerous. Let me tell you about Roberto, 74 years old, a man full of energy who played golf, traveled with his wife, and savored every moment with his grandchildren. He was completely healthy, without a single symptom. His son, with the best of intentions, gifted him a full health screening that included one of these scans for his birthday. Roberto went mostly to make his son happy, and that is precisely when his troubles began. The scan report arrived with a phrase that turned his blood cold: indeterminate lesion of 1.5 cm detected in the left kidney. Indeterminate lesion, 2 words that function like an anxiety bomb. Overnight, Roberto stopped being a healthy man and became a patient with a kidney problem. His doctor, following protocol, sent him to a urologist, who recommended a biopsy, which meant inserting a long needle through his back into the organ, with real risks of bleeding, infection, and intense pain. Roberto agreed courageously, and the result came back 1 agonizing week later: an angiomyolipoma, a completely benign tumor made of fat, muscle, and vessels that would never have caused him a single problem. What did Roberto gain from all of this? Nothing, and what he lost was irreplaceable: his peace of mind, his sense of safety, and his family's stability. His case is not the exception, it is tragically the rule. Studies show that up to 86% of healthy older adults who undergo a full body scan receive findings of some kind. The vast majority of these findings are what we call incidentalomas, accidental discoveries that are benign, harmless remnants of time: spots on the liver, cysts on the kidneys, nodules in the lungs, scars that have been there for years without causing any trouble. The real danger is not in the finding itself, but in what follows, the cascade. Every week, patients arrive at my office, brought by worried children because they occasionally forget an actor's name or walk into a room and forget why. These are typical, normal signs of aging, and yet the fear of Alzheimer's is so powerful that families demand an MRI to see what is happening inside the brain. Let me be very clear: ordering an MRI in this situation is almost always a serious mistake. Martha was 78 years old, a brilliant woman and devoted reader, who sometimes struggled to find the exact word she wanted. Her daughter convinced her to have an MRI, and when they read the report together, Martha's world collapsed. The radiologist described diffuse cortical atrophy, mild and appropriate for age, and scattered white matter gliosis. For a physician, this describes a completely normal brain at 78, like saying someone has wrinkles or gray hair. But for Martha, those words sounded like a death sentence. She became convinced she had early Alzheimer's, and no medical explanation could calm her. For months she lived in relentless anxiety, interpreting every forgotten word as proof of decline, withdrawing from friends, abandoning the reading she loved. All of this because a report described a perfectly normal aging brain. Studies confirm that more than 50% of cognitively healthy adults over 70 show small abnormalities on MRI, and these findings do not predict Alzheimer's or dementia, they simply reflect the passage of time. Now I want to be fair, if someone is experiencing significant memory loss that interferes with daily life, getting lost in familiar places, dramatic personality changes, or difficulty making simple decisions, then yes, evaluation including MRI may be appropriate. But for mild benign forgetfulness, the smarter path is a functional cognitive evaluation, a structured conversation with validated tests measuring memory, attention, language, and problem solving, focused on how the person actually functions in real life. The third test I would avoid is the routine stress test in older adults without symptoms. Many believe it is sensible to test the heart on a treadmill before starting an exercise program, but for most asymptomatic older adults, this is not only unnecessary, it is potentially risky. Ernesto felt perfectly well and simply wanted to start walking daily. His doctor ordered a stress test as a precaution, and during the test, the electrocardiogram showed changes suggesting a possible cardiac issue. No pain, no breathlessness, just a change on paper, but it triggered a cascade that ended in a coronary angiography, an invasive catheterization procedure. The arteries were completely normal, a false positive, but the procedure had already carried real risks of bleeding, infection, and even a procedure-induced cardiac event. Up to 50% of adults over 70 can show electrocardiogram changes that appear abnormal but are not truly so. The smarter alternative is a simple clinical evaluation, an examination, a blood pressure check, a conversation about how you feel during daily activities. If there are no red flags, the advice is simply to begin gently and listen to your body. The fourth test is the routine colonoscopy after age 75. For years we were told correctly that colonoscopy saves lives by detecting colon cancer, and it does, up to a certain age. But after 75, the balance between benefit and risk shifts dramatically. Dolores was 80 years old, active and healthy, when her physician recommended a routine colonoscopy. The preparation was grueling, a full day of laxatives without food, already a serious risk for someone her age. And then came the sedation, which carries higher risks of confusion and respiratory issues in older patients, plus the most frightening complication, intestinal perforation, which doubles or triples in those over 75 and can require major emergency surgery. Major medical guidelines already recommend stopping routine screening between 75 and 85, because it is more likely that the colonoscopy causes harm than that it saves someone from a cancer that would take 10 more years to become a problem. The smarter approach is vigilant symptom monitoring. Any persistent change in bowel habits, blood in the stool, unexplained weight loss, or new anemia warrants immediate investigation regardless of age. Combined with a fiber-rich, anti-inflammatory diet, this is far safer and benefits the entire body. And the fifth test, designed for men, is the routine PSA screening in older adults, particularly those over 75. PSA was once promised as the great breakthrough for early cancer detection. The problem is that prostate cancer biology in older men is deeply unpredictable, and indiscriminate PSA use has created an epidemic of overdiagnosis and overtreatment. Carlos was 80 years old, independent and active. when a routine PSA came back slightly elevated at 6.5. He felt perfectly well, but that number launched a cascade that ended in a prostate biopsy, a procedure with serious infection risks, and Carlos ended up hospitalized with sepsis. When the biopsy results returned, they showed a Gleason score 6 adenocarcinoma, the most slow-moving, least aggressive prostate cancer that exists. Autopsies reveal that up to 80% of men over 80 have prostate cancer foci that never affected them in any way. But Carlos heard the word cancer, and he chose radiation therapy. The treatment worked, but the price was devastating. Incontinence and erectile dysfunction, his social life crumbled. We cured a cancer that would never have killed him, and in doing so, we destroyed his quality of life. For every man saved through PSA screening, approximately 50 are diagnosed and treated unnecessarily, carrying permanent consequences. The smarter path is an informed shared decision, an honest conversation between physician and patient, with real numbers and no medical jargon, followed by vigilant attention to genuine symptoms such as difficulty urinating, blood, or bone pain. And so we arrive at the end, 5 tests, 1 powerful message. Medicine at its wisest is not about finding more, it is about finding what truly matters. The full body scan manufactures anxiety from nothing. The routine brain MRI labels normal aging as pathology. The stress test creates risks for people who simply want to walk. The late-life colonoscopy tips the scales toward danger. And the routine